Good afternoon, everyone. Thank you all for coming today. As Cecilia's already alluded to, my name is Kath Norris and I am Head of Nursing at Swansea University. So it's very nice to meet you all, and I'm looking forward to meeting you all in person, and also congratulations on your offers as well. So my part this afternoon is just going to go through a little bit about the programme, so you probably have a good understanding about it already, otherwise you wouldn't have applied. But just to give you an idea of some of the structures and how we work, a little bit about our support mechanisms and how we sort of manage that for our students as well. So again, Cecilia's obviously said that after I will do my bit, Christina's going to discuss an occupational health perspective as well, in line with your vaccinations, your health checks and all those kind of things as well. And then Cecilia and the international team, because we've got Emma on the call as well, will be discussing some additional information and preparations that you may need. As Cecilia's already said, if you do have any questions, please pop them in the chat box. And again, don't worry if you think they're a bit daft or a bit silly. They're important questions to you that need to be answered. And we will do our best to answer the questions. And if we can't answer them for you today, we will endeavour to get the answers to you by next week as well, because sometimes we don't necessarily have all the answers here today as well. So if everybody's happy, I will now do my little bit about nursing, and I will apologise if I keep moving my head to the left because my presentation is on my other screen, so please accept my apologies if you kind of just see me shuffling around and moving around a little bit as well. So first of all, obviously, you know, you've obviously done your research here as well to say, why do you want to be coming to Swansea, what we have, what we've got to offer as well. So you can probably see here on our little map there, this is Wales. And in comparison to your home countries, this is probably really, really small in its vastness compared to sort of, you know, the huge continents that you guys, you know, travel and come from as well. So we are, as Swansea, we're the second largest city in Wales, and we have roughly over 250,000 people living within Swansea. The best part about being on this campus is we are right on the seafront. So both our campuses are very, very much on the seafront. One of our hospitals is very much on the seafront as well. And our clinical practice areas, we range as far as sort of furthest West Wales point that you could get, which is right down to the coast, all the way up to mid Wales, again, roughly by the coast and inland, and then we head out towards sort of southwest Wales as well, where our cut-off point is as well. So communication wise from travelling, we know in a car journey we probably are less than 1 hour from Cardiff. By train it's about 3 hours to London, and to go to Manchester it's roughly about a 4-hour drive, or roughly about a 3.5 to 4 hour train journey as well. So from a logistical commuting perspective, Swansea is a really great place to sort of come to and study and commute as well. As I've already said, we are right by the beach as well, and that's one of our biggest selling points. And these are just not images that we've sort of picked from Shutterstock or anywhere like that. These are actually images of our students by the beach. Literally, that's what you see. You walk down the steps and you are there on the beach by the water as well. And again, both campuses are within easy walking distances to the city centre. It's very affordable to live here as well. The totalmonies.com tells us that Swansea is the third most affordable student town within the UK as well. And again, you know, that's very attractive to our students who come to live here. So the city itself, this is historically our city was very much built on the coal and the Iron Age, and we've gone through major redevelopments over the last 60 to 70 years in bringing us forward as part of becoming a city. The Daily Telegraph now tells us that we're the most welcoming, we're the most friendly and trustworthy city in the UK. We've had over £500 million redevelopment in the city, and this is still ongoing there as well. We have Liberty Stadium, which is home of Swansea City Football Club, the Ospreys rugby team. We also have a range of live music events, concerts that go on there as well. We recently had a new concert hall venue opened as well. And for some of you who maybe you're familiar with your pop music, we had Alice Cooper here a couple of weeks ago. We've, you know, so for us in Swansea, that is really great, really huge for us as part of our developments as well in moving forward. And again, for our student attraction as well, you know, in the city arena. From a university perspective, because this is obviously very important to you as well as part of your study, we're a very red brick university, and we were founded in 1920. And we have dual campuses on the beach and sort of in a park area as well. So the top left-hand picture that you will see on your screen, this is our Singleton campus. And this is where, as a nursing student, where you will reside and do most of your studying at. And as you can see towards the back, we have the greenery Singleton Park, and right to the front of the images as well, we have the beach. The other campus that we have, again, is our newer development as well. So again, you know, but it's right by the waterfront as well, and it's right by the bay, hence the name of the campus, Bay Campus. And the top one where you study nursing is called Park Campus, again, because we have the park behind us as well. We have over 20,000 students studying with us and over 3,500 international students. Our staffing complement to Swansea is over 3,000 staff, and we have staff and students from over 130 different countries. And within the Department of Nursing, you roughly have between 80 to 85 members of staff, all predominantly nurses who remain on the nursing register and are current within their practice, who deliver the nursing programme and who teach you in your studies as well. So Swansea, for us as well, we have a gold in teaching and excellence framework as well. And since 2018, we've had this, and we still uphold this ranking as well. So when you come into the university, when you come over to the UK, as you drive up the main dragway, you will see our flags, our signs, telling everybody that we are really proud that, you know, for the last 4 years, we've got this excellence in teaching frameworks. And to get this award, it focuses very much on our student satisfaction rates, our continuation rate, our employment rates, and the academic support that we offer students as well. And from a nursing perspective, we pride ourselves very much on those 4 areas there as well, in what we do and how we manage and support our students within the university and in the department. So when you do come to study with us, your studies will sit within the Faculty of Medicine, Health and Life Science. And within that faculty, then nursing sits within the School of Health and Social Care. So within this faculty as well, we have really good global research impact. We're very much about in what we do about improving health, improving well-being and the wealth of society. And we strive to do this through our educational programs, through our research programs and our innovations that we do with our partner health boards and other businesses within our local communities as well. As I've already said, the faculty sits as 3 schools. You've got the School of Health and Social Care, where all the professional programs sit, such as nursing, paramedics, midwifery. And then you have the medical school, as the name suggests, that's where the medical students reside, the pharmacology students reside. And then you have the School of Psychology, where all the psychology students reside. So in fact, we are one of the largest faculties, student number-wise, within the university. We very much draw together disciplines of public and allied health, nursing, social care, psychology, medicines, pharmacy, life sciences, and many, many more as part of the teaching and your journey within Swansea as a student nurse. And again, as you've applied for nursing, we're accredited by the Nursing and Midwifery Council, and all of our professional programs are accredited by either the General Medical Council, the General Pharmaceutical Society, Royal Pharmaceutical Society, and Health Professional Wales, and all different ones as well. So we are very proud of the accreditations that we hold as well. So just some information here for you, kind of where we are and where we sit. You know, we first in the UK for medicine, we're in the top 10 for health studies as well. You know, we are 6th for student experience within the UK, and we also sit quite highly as well in our World University rankings for different elements within our programs, our suite of programs as well. And like I said, you know, for us as well, we're internationally recognised for research, and we have an area of excellence as well. So you come into a very well developed research-based university as well in what we do. And as you can see, these are just some of the statistics that we have there. So why do you want to come and study at the School of Health and Social Care as well? These are the kind of questions, you know, and again, there's some more information there on that web email address there, and anything that you'd like to know, please come back to myself or Cecilia about the nursing programme, Christina in view of Occupational Health, and we can field all the questions for you as well, guys, okay? So before I go on to sort of talk about the nursing programme, for us, what we are very, very proud of at the moment is that for Swansea, we are still in the top 10 for nurse delivery as well, which is really excellent for us. And we remain the top university in Wales for nursing as well. We have another 5 schools of nursing that deliver nursing across Wales, and Swansea University remains number 1. And our children's nursing programme is the 4th in the UK and has been 4th in the UK for the last 2 to 3 years. So again, we are super, super proud of our achievements in what we have as well. So this is obviously, like I said, congratulations on your offer. So again, you know, some of the sort of housekeeping issues, like for nursing, we have a programme that is longer than any other programme that sits within the university. So you actually study for 42 weeks out of the 52 weeks. So therefore your academic year will always start that little bit earlier than any other sort of traditional university student. The reason for this is that we have to make sure that in order for you to register on the Nursing Midwifery Council and obtain your degree, you have to do a preset amount of hours over the 3 years to achieve this. And the only way I can get that to happen is by starting your academic year a little bit earlier. So for the September 22 intake, the start date is going to be the 19th of September. You have to be here on the 19th in person. There are no dispensations, there are no extensions. This is when it starts. So please make sure that you have everything ready to start on the 19th of September and be a resident in the UK as well. And would always advocate that you come a couple of days before, just so you can familiarise yourselves with the location, your accommodation, the university, and where you need to go and what you need to be doing. So as I've already told you a little bit about, it's a composite programme, and when you have a chance to read the slides, there's a lot of university speak and language in this. But what a composite programme means is that there is no options for you to pick or choose what you want to do, that it's what is set out as in the curriculum and its core modules. And the NMC, the Nursing Midwifery Council, have agreed that what we are offering as our programme is the standards that they would expect us to embed in a student nurse, and the learning that is expected by the Nursing and Midwifery Council in a student who will graduate in 3 years' time. So it's all about, we work on a spiral curriculum. So as you go through year 1 and year 2 and year 3, you might think, oh, well, I've already covered this. The answer to that will be yes, you will have already covered it. But we then in year 2, we explore it in more depth. We take it to the next level. So hence you have that spiral, that loop. You constantly revisit it as well. We implement a blended learning approach, which means that, you know, the programme is 100% blended learning, but then the programme will be split between synchronous and asynchronous learning, which means some of it will be face-to-face, some of it will be in clinical practice, some of it will be in a practical skills room in the university, and some of it will be online for you as well, and some part of directed learning. So it implements that flexible learning, so we ensure that we encompass, you know, a well-rounded nursing program as well for all our students. So how do you learn? So in essence, it's a 3-year full-time program, and it comprises of 360 credits. So each year you have 3 modules, which consist of a practice module and a theoretical module, which is worth a value of 40 credits. And you have 3 of those in a year, which gives you the 120 credits. Once you have completed the 120 credits in that year, you're allowed to move to year 2 and year 3, okay? As I said, it's all about that spiral curriculum. So we, as you develop, we increase this level of complexity throughout the program, and we do this in a very incremental fashion for you as well. As I said, it's very much research-led. We have a learner-centered philosophy. We employ a variety of teaching and learning strategies that helps inclusive and collaborative learning as well. And as I've already said about blended learning, it's about a different way of delivery that's suitable to all our students, because we have a very inclusive approach in what we deliver as well. So part of what we do, we help prepare you to become nurses, and there are certain key skills, cores and values that we instill across our 4 fields of nursing, such as law, safeguarding, consent, pharmacology, medicines administration, because lots of these, the NMC tell us, we must teach you in order for you to be proficient and be able to be registered at the end of the 3 years. So as I said, there's a lot of it about sort of the educational aspect of what is research, why is evidence important, but there's also that element of you need to understand about consent and why is it important, consent. It's about, you know, learning about drug administration, medications, the law around it. Because again, once you're on that register, you have that ability to dispense medications to your patients. So we need to make sure that you fully understand the concepts and you're safe as well in doing that. So as part of teaching and assessing, what we do is it's all about, we map this throughout your student journey. And what I would suggest you do is that if you do a quick Google search and you put the NMC 2018 Future Nurse Proficiencies, you will have the documentation there that we've actually based our nursing program on. And you will see then how we take elements of what is needed in that future nurse ideology into the nursing program, and you can see how we map things across as well. So examples of how we deliver teaching for you: we have discussion groups, we have some simulation teaching, we have individual and group academic mentoring, you have some guided reading activities, you have independent learning, we do role play, you have practice learning opportunities within clinical practice, we do skills rehearsal involving patients and carers, we do inquiry-based learning, we do on-site face-to-face simulation, but we also do VR simulation. So there's lots of different ways that we embed all these skills into you. And remember, we have 3 years to teach you all of these as well. So don't have a panic to think, oh my gosh, there's an awful lot here and there's an awful lot happening. This happens over 3 years. So as part of doing your nurse training with us as well, you have to complete all the elements of your assessment in order for you to progress and complete the nursing program. So the way we design the curriculum, we make sure that it's very diverse. We have an inclusive assessment strategy to meet the needs of all students. And our assessments are innovative, they're authentic, and it looks at sometimes the overall program aims as well, because each module will have an aim and an outcome, and your assignment is very much geared up to meet those aims and outcomes, as well as what the NMC require of your abilities as well. So There's some examples here of how we assess you over the 3 years, because we know not every student is great at writing an essay. Some might be better at doing an OSCE, others may be better at doing a computer-based assessment. Some might be better at doing a blog or a wiki. So we have a variety of assessments to give every student the opportunity to shine and excel as well. So as you sort of look at the syllabus and the curriculum, not everything is going to be an assignment that you're going to be writing. Yes, at the end of every module, there is an assessment, but how we get you to do that assessment is varied. So this is an example of the program that you have over the 3 years. They're all core modules, which means that you have to undertake these modules. There isn't a choice of dipping in or dipping out, because I said it's a composite program. So each year you have 3 modules, and within those modules then you will have a clinical practice opportunity, and you will also have a educational theory block as well. In the theory block, you will have that assessment to do at the end, and in your practice block you will have clinical assessment competencies that you have to achieve, because remember, you are studying for a university degree as well as a registration with the NMC. So this is where the 2 sides come into it as well. But these are the modules that you will study. And then if you go and look on our website and you can click onto the homepage of Swansea Nursing Adult, it gives you some information in and around these modules as well. So as I said, you know, we have to do clinical practice as part of what we do. And we work with a number of our practice learning partners, such as Swansea Bay, Howell, Barcombe, Taff. We work with a number of them as well. And we offer you a variety of practice learning placements over the 3 years. In a surgical, medical ward, you also go to critical care areas. We do community nursing. You can do health visiting placements. We also have primary care settings such as GP surgeries. We also work a lot with community groups, so you get to spend some time with the homeless nurse, looking at social care workers, also working with pharmacists, also working with GPs. We also facilitate some learning with our charity partners such as MENCAP, Holrid Foundation, the learning disability sectors. And we also offer placements in our local category C prisons as well. So you have a wide variety of exposures and experiences within your learning as well. So as I said, you know, you have to complete clinical practice and you have to complete the academic side, okay? So the placement and your practice assessments in clinical practice gives you the NMC registration. The academic will give you the degree. In order for you to have a qualification at the end, you have to have the both to practice with the NMC. You cannot fail on the academic side, pass the clinical side and register with the NMC. It doesn't work like that. You have to have the both together in order for you to practice as that nurse, okay? And as I said, you know, the NMC in the UK is a very prestigious recognition of qualification as well. And lots of countries do look to the NMC as being the gold standard of nurse registration, the way we are managed. And throughout the 3 years, we very much embed and instill the philosophies and the mindset and the code of the NMC about professional standards of practice and behaviours that we would expect in our nurses and our midwives as well. So just remember, you have to pass academically and clinically to have that registration at the end of your 3 years. So how do you access your course information? And I don't know if my link will work. It may do. Yes, it works. Look at that. Can you all see the changing screen?
No, you might have to share this again.
Yeah, I knew it wasn't going to be that good. I knew it wasn't going to be that clever. See, I tried to be clever and look what happens, guys, isn't it? Right. Okay. Let me just see if I can stop sharing this screen a second. and I will go in to show you my Canvas screen. Hang on a second, guys. Right, let's have a look at that one. There. So can you see that one now?
Yeah.
Yeah, can you see? And I've got a QR code there, yes? Excellent. So if you've got your phones with you now, hopefully you should be able to scan that QR code, and that will give you a link straight to our practice assessment guidance about the PAD document, what we need you to do, what we expect you to do. So, you know, we start off signposting you very, very early. All the information you'd have for the first module sits on your Canvas page. So you click onto the module, and then it tells you there, we've got all the links there that you need for things like the booklet about the course, the contact details of the people that are there, library links, all those different informations there. Bits about referencing guides, academic writing, and then as you scroll down, you have sort of examplers. You just click on there and you can see the presentations then that we cover as well. So all of this will be up and ready and running. So you access this on a daily basis. So all your teaching sessions are there. All your Zoom deliveries or Teams will be done through Canvas as well. And all your assignments are submitted there as well. And any communications that we have with you as well come onto your Canvas homepage as well. So once you become a student and you have a student number, you'll be able to log into Canvas, and all of this will be given to you sort of as part of what you do. And then this is how we communicate with students as well. So any announcements that we have in relation to a module goes on the announcements page there. Very easy to navigate, very easy to learn. It's just a confidence and a practice thing as well. So each module has its own page set up there for you. So once you complete the first module, you then have access to the second module, and you have access to the third module, and so on. And that's when you have all the information there. So we tell students, you know, what you need to know before submitting your assignment. So it tells you about academic support, extenuating circumstances, academic integrity. So just going back to what I said earlier, we very much pride ourselves on giving lots of information to students, being that supportive environment to help students learn. And Canvas is a very good notice board as well for us to share those type of things as well. So that is Canvas, and that's how we work with that one there then. So if I just go back to the presentation, which is there. Oh, she says she can't find it now. There, okay. Are we back on the presentation, Cecilia? Yeah, great, okay.
Yes.
So that's there. So that was that one there. So the other thing I just need to show you quickly is, do you remember I said before I go to Christina about I've talked to you about theory and I've talked to you about practice. Well, this is roughly what your year would look like. So let me just stop sharing that one a second. And so this is roughly how we split your program up, okay? So please ignore the date there, because it's the September 2019 intake, but this is what their year 3 planner would look like, okay? So roughly, as you can see, we split college blocks, practice blocks, and then this is your holidays as well. So when you start in September, you are clearly going to be access to a planner. This is available on Canvas, so you're able to see how many weeks you're in college, how many weeks you're on placement, and when your holidays are going to be. We preset the holidays. Roughly, you tend to have around about 4 weeks in August, usually about 3 weeks at Christmas time, and 2 weeks in and around Easter time. Now, the summer ones are always around about the 1st or the 2nd week in August. The December ones are either the last week of December or the week before December, but the Easter ones will always move because Easter doesn't stay, as it's a movable feast. When you look at the calendar, sometimes Easter falls very early in April, or it can go to the very end of April. So that is usually the one that's quite movable. So again, if you need to travel back home, always make sure you check your planners before you make those dates, because as I said to you before, it's all about meeting the requirements and those hours for the year and the 3 years that you have, because we map the hours year 1, year 2 and year 3. Okay, so that's kind of my section of it, and if you do have any questions, please put them in the chat box or come back to me, Cecilia, afterwards. I'm now going to hand over to Christina and for her to talk about the occupational health section.
Hi Cass, can you share the screen again? I don't have a copy of the presentation. Lovely, thank you. So I'm Christina Bond. I'm one of the occupational health advisors at Swansea University. So my background is nursing with a specialist qualification in occupational health. So I'm a qualified mental health nurse. And you've got a team at the university, a mixture of nurses, advisors. We have our admin team and an occupational health physician as well. So our role, because you're on a regulated course, you'll be expected to meet certain standards, which other students in the university obviously don't have to. So we're here to sort of help you along the way with any issues with regards to your own health and well-being, to make sure that you're fit to attend the course. So if you have any disabilities or health conditions, it's important that you put those on your declaration form, your health declaration form, which you should receive, so that if you need any adjustments, so for example, if you have dyslexia and you need any adjustments for that, then obviously we need to try and get that sorted for you before you start your course where possible. And initially that will be done via a telephone call. Just to check if you've raised anything that, you know, we need to put adjustments for. We'll arrange a phone call to discuss with you. So once we receive your forms into the university, we'll do a screening of your form. We'll go through it and look at whether or not you've declared any illnesses or disabilities. And we'll check your vaccination records as well to make sure that you comply with the UK requirement for vaccinations for nurses. If you have any problems throughout your course as well, you can also ask your tutor to refer you into occupational health so that we can give any advice for you for health and well-being reasons or any other concerns. You've also, of course, got access to student services if you're struggling with any mental health problems that we can also send you to. Next slide, please, Kath. Oh, okay, I think they've gone in a funky order there. So if I could move on one. Lovely. Immunisations. So we provide occupational immunisations and blood test screening, which, you know, if you've got any concerns about, you can always email us. We'll go through what exactly they are on the following slides. Next slide. So hepatitis B. So in the UK, this is something that's only given if you're going to be travelling abroad. In a lot of countries, overseas countries, India, Africa, and many other countries, it's given at birth. It is a series of 3 vaccinations, and hepatitis B is a blood and body fluids borne virus. So it's something we like to try and help prevent if we can. So you'd be required to have the 3 vaccinations. If you haven't had them prior to attending the university, then obviously we will offer those to you once you start. If you have a needle stick during your course, then you'd also contact us and we would retest for your hepatitis B. What we often find, though, is a lot of people have had the vaccinations themselves as children, but they haven't had the blood test to make sure that they've got a good antibody level. So that's something that we will check when you arrive, or if you've already got those records, you can have them done within your own country. Next screen, please. Measles, mumps, rubella. So this is important. You need to have had 2 MMRs before you start your course, before you're allowed out on placement. Now, some countries, certainly India, we've noticed they tend to have a single measles vaccine and a measles, mumps, rubella vaccine, which unfortunately doesn't meet the requirements in the UK. So if you can get them done before you come across, then that's extremely helpful and speeds up the process. So you'll need 2 measles, mumps, rubella vaccines to comply with our requirements. Next slide. Tuberculosis. So this is another vaccination that it tends to be given overseas, which we don't give in the UK except for certain occupations anymore. So this is a virus which is transmitted through sort of droplets and close contact with people who have tuberculosis. So if you come from a country which has a TB rate of over 1 in 40,000, then you'll be required to have a repeat screening when you arrive in the UK. So normally it's a requirement to enter the UK anyway, that you've been screened in your own country, and you'll usually have a certificate issued to you to travel. And when you arrive, you will still need to come to us for what we call a MAN2 test. And this is to check that you don't have tuberculosis before you start your course, even if you've had a BCG in the past. And the reason for this is that immunity can wane, which means you can still pick tuberculosis up later on. And it's really important. You'll have 2 appointments booked. They'll be scheduled into your timetable. If you do not attend these appointments, you will not be cleared fit to attend your placements. So it's really important you make those appointments and attend them. Next slide. Chickenpox. This is something we've also noticed. Lots of people last year weren't immune to chickenpox or varicella. So chickenpox is an illness of childhood generally. We'll check with you when you start whether or not you've had the illness. And if you're not sure, we'll do a blood test when you arrive to make sure, and then we can offer you vaccination if you're not immune. It's really important because it's very high risk to women that are pregnant. Next slide. Okay, so this is our most important one. You'll have appointments scheduled in throughout your course to attend for vaccination and health clearance. It's really important you attend those appointments. One, because come September, we are extremely busy. We have well over 1,000 students that we have to see in our department. So it can be really hard to reschedule. So they'll all be scheduled into your timetable. There's a system in place now whereby when it's scheduled in, you go on, you book your appointment time with us, and then you turn up to your appointment. We'll assess what you need vaccination wise, and then rearrange any follow-up appointments for you. But if there are any queries with that, you can always drop us an email before you start, and we can answer those questions for you. Okay, and that's it. So just to say as well, obviously we understand that it can be very difficult coming to a different country, different sort of health regulations, different requirements, but also the fact that you're away from family and friends and lots of other things that you know. So if you're struggling at any time with any of that, if you're struggling with your mental health and well-being, anything that you need that we can help support you with, you just ask your tutor to send in a referral to us, and we will try and help you or direct you to somewhere where you can get some additional support. Thank you very much. If there's any questions, please feel free to pop them in the chat.
Thank you very much, Christina. So it's over to me now. I'm really sorry, my internet connection's not great today, so I'm going to keep my camera off. Hopefully this won't disrupt the sound coming through to you guys with the information that I'm giving to you today. So I'm Cecilia. As I mentioned, I'm the Internationalization and Recruitment Manager at the faculty. And also on the screen here, you can see Bethany as well, who may have also been in touch with you. So we are the team that looks after international students from being an applicant to your enrollment, so looking after you from now until September when you arrive to Swansea. Next slide, please. Okay, so a little bit about logistical arrangements. So the tuition fees for you for starting from September 2022, you'll be looking at £16,500. The yearly tuition fees will increase approximately by about 3% every year, but you'll be notified of the amount from our finance department. In addition to the tuition fees, you also need to pay a clinical practice fee of £2,500 each year, but you will receive an automatic clinical bursary of £1,500 per year. So this means then, in addition to your tuition fees, you'll be paying an additional £1,000 on top of your tuition fees. Next slide, please. Some information about scholarship and funding as well. So as an undergraduate student, you will have the opportunity to apply for the International Excellence Scholarship. If you're successful, you'll receive up to £6,000, which will be deducted from your tuition fees. How that works is that in the first year, you'll receive £4,000, and then you need to make sure that you achieve an overall 70% or above. So there's a first class degree in your first year, and then you'll receive the remaining £2,000 in year 2. There will be an application system to this. So if you take a screenshot, and we'll share the slides with you following today as well. So the link on the page will send you to the application page. You'll be able to see the terms and conditions. And one thing to bear in mind then is to make sure that you submit your application at the very latest by the 20th of August, 2022. On this page as well, if you're not eligible to apply for this one, there will be other scholarships that you can look at and check out your eligibility for those too. Next slide, please. In terms of your accommodation, very important to make sure that you book your accommodation and have it confirmed before you come to Swansea, so you're not left stranded without anywhere to live. So we've got a range of university accommodation. The link on the page here will send you to our accommodation page, and on there you'll be able to see a number of different virtual tours of the different style accommodation you can see. They cost between £91 to £195 a week, depending on what your preference are. So we'll recommend that you live at the Singleton Park campus as well, because that's where the nursing program is based. So it's better that you're based locally on the campus where the faculty is. And the other thing to note is to make sure that you submit your accommodation application at the very latest before the end of June to receive guaranteed accommodation. Next slide, please. Now, the next part is to get your cash statement. So that is your confirmation of acceptance for studies. So this is a document that you need if you need to apply for a student visa. So this year you'll be invited. So you should have all received an email to invite you to register on Cash Shield, which is the application system where you will be uploading all of the relevant information in order to go through the CAS process. So if you haven't already got that, get in touch with us and we'll check that out for you. The next thing you need to have is an unconditional offer. So if there's any academic conditions left on your study, you will not be able to get a CAS statement. So you need to make sure that you submit all the relevant evidence that we need, whether it's English, whether it's your high school when you have them, whether it's your police check, your occupational health. You need to do all of those before you'll be able to proceed on to getting your CAS statement. You will have already submitted a reference as part of your application, but if we find that we needed additional information from you, our CAS team will then get in touch with you to request for an additional reference during your initial application, and we'll need this for your CAS statement. And then finally, you need to make a deposit payment of £4,000, or if you are sponsored officially by an official financial sponsor, then we'll need to see your letter, your official sponsor letter. So you need to submit that on Cash Shield as well. So on the website here, you'll see instructions of how you go through that. It should be really easy for you to follow the system through Cash Shield. As soon as you register for an account, you'll be able to see everything that you need to provide. There'll be a checklist on there. So make sure that you provide all of the relevant information and meet the conditions of a statement as soon as possible. So you're leaving yourself enough time then to apply for your student visa. Next slide, please. Other helpful information for you, and as I mentioned, we will share these links with you, but feel free to take a screenshot of it as well. So fee payments schedule, and the first installment, so at least 50% of the tuition fees will be due before or at enrollment in September. The remaining 50%, half of that, 25%, will be due by the 1st of February. And then the final 25% will be due by the 1st of May 2023. We also have an international at Campus Life department who's there to support all of our international students, including activities that you can join to meet other students on different courses at the beginning during Freshers Week. So they've put together a student guide that will give you a range and a variety of information on how to settle in living in the UK and living in Swansea, including things like registering with a doctor, registering with a dentist, how to open a bank account, etc. And also there's a link on the site here as well, on the page here as well, about any welcome activities that you can join when you don't have lectures happening. Important link here as well on how to get to Swansea. So at the beginning of the presentation, Kath's already mentioned that we're an hour from Cardiff, or we're 3 hours from central London. So those will be the airports that you'll be looking to travel to. So either London Heathrow, or if you wanted to, the closest airport to us is Cardiff Airport. Thank you. Next slide, please. Okay, so some key information for, oh, Kath, can you go back a slide for me? There we go. So arrival and enrollment information as well. Apologies, there's a bit of a typo here. So the start date for adult nursing is the 19th of September. And as Kath has mentioned earlier, we recommend that you arrive a week before, if you can, before the start date. So you've got time to familiarize yourself with the location, where to get to the buildings, how to get to your lectures, things like that. So as part of your offer, you'll need to make sure that you submit your police check and pass a police check. So that's what we call the DBS here, Disclosure and Barring Services. So there's a link for you to follow, which will give you guidance on how to apply for the police check in your home country. Occupational health, we've already talked about that. So the contact email address is here, and also making sure that you submit your questionnaire if you haven't already done so as soon as possible. And then some pre-arrival information. So the main thing for you is that at the beginning of September, please make sure that you keep an eye on your email, because you'll receive invitation to start your online enrollment. So the online enrollment will involve you submitting all your ID documentations, your payment of fees, and you complete that online before you'll be able to enroll and have access to Canvas, which is where you access your learning information. So please make sure that you keep an eye on your inbox, look out for an email that will invite you to start your online enrollment, and that will open on the 12th of September. Next slide, please. Okay, and finally, just some key contacts for you. So you've got my contact details anyway. So thanks for joining us today. So my email address is on here. You'll have the opportunity to meet with one of us in the team as well. If you've got specific information that you need, your individual circumstances that you wanted to find out, just make sure get your questions answered. You can either book a one-to-one meeting with us. So we will have an appointment Wednesday, or every Thursday between 10 to 12 UK time, there is a drop-in session. You don't need to book for this. You just need to join in between 10 and 12, and you'll be able to speak to one of us individually as well. So you'll be able to access the information via the link here on the top. And then at the bottom of the page here, it's just some key useful contacts for you in case you needed any additional information as well. So we've got the nursing admissions team, so Emma Hawkins on the call today. So if you've got any information, if you need any help with your admissions, you can get in touch with the international nursing email inbox. We've got the occupational health team, we've got the enrollment team, information about your tuition fees, sponsorship, visa letter, or accommodation as well. So important for you to take a note of these contact details. If in doubt, always come back to us at the international team within the faculty. And if we can't help you, we will be able to point you in the right direction. Thank you. Next slide, please. So the end of the information session, here's also an email address. If you've got any questions, there's another way to get in touch with us. So just to remember that we're here to help. You have about 3 months now before you're due to be in the UK. So make sure that you get everything done as quickly as possible. If you get stuck or if you think that you've been waiting for some time for information, get in touch with us and we can check on the status for you. But the main thing is try and get everything done as soon as possible now, so you're not delaying your arrival date, because you won't be able to get an extension to start this program for nursing, because the program will be starting promptly on the 19th September. Okay.